My name is Ruth O'Flaherty. I'm a veterinary surgeon and clinical director here at Sunbeam Veterinary Hospital. I joined a couple of years ago when I moved back from England home to Cork and have settled in really, really well. Yeah. So at Sunbeam we are a big group. We are 5 sites supported by the veterinary hospital where we are here and 4 satellite branches, and we are a team of currently about 52 staff. So we have about 22 vets, 30 nurses and our support staff as well. At Sunbeam we offer first opinion service, so from anything from vaccinations to lumps and bumps, lameness, and we also offer referral service for ourselves and our veterinary colleagues for things like CT scanning, laparoscopy, hospitalisation, blood transfusions, things like that. Yeah. So I qualified from UCD about 11 years ago, and I would have been working with VPG in my first job, which was also in Cork, so since the start. Yeah. I suppose for us as a Cork-based practice, VPG is based in Cork, and for that local service that the lab is merely just a 10-15 minute drive away, it makes things so convenient for us and for our cases and our patients. So VPG kindly arrange a courier service for us every kind of lunchtime. The samples that we have stored in the fridge get collected and brought straight to the lab. But we also find super convenient that VPG have a post box outside. So if there's anything urgent we want to get over to the lab, any of us can run it over and pop it in the post box, so then it will hopefully be ran first thing the next morning. Majority we'd get results that evening, which is outstanding for us and our clients. Obviously there's certain tests that take a little bit longer, but it's always very clear the expected turnaround time when you book the test, so it helps us manage our own expectations and that of the client when we'll expect results as well. For me, probably cytology, because I'm not a fan of the microscope. So it's really super quick turnaround, generally 24 hours. If you have a cytology report, we see lots of lumps and bumps, swollen lymph nodes, we get lots of ill dogs with fluid in their abdomen, chest, and those cytology reports really help us get to a quick diagnosis. So we always have a friendly face at the end of the phone in Pedro. He's extremely helpful, informative, he's a fountain of knowledge and always very helpful to guide you on the kind of next step or next appropriate test, for example, that would be helpful for your patient. So I really like the panel, the infectious diarrhea PCR panels. I find that really helpful because oftentimes, of course, a client can tell you their dog has diarrhea, but it's nice for us to tell them why and what exactly is causing it, and then to treat more appropriately. Also doing culture and sensitivity, getting antibiotic sensitivity and recommendations is really helpful for us to be mindful of our antibiotic use as well. Yeah, I mean, a few come to mind, but a very common one that we would see would be dogs with a low pack cell volume, who might be borderline on blood transfusion criteria, and getting their haematology to the lab for an anemia investigation will guide our treatment very, very rapidly. So there would have been a case a few weeks ago of kind of like a 7-year-old Doberman came in, collapsed, pale, with a pack cell count of I think it was about 12. So we got blood straight to VPG for an anemia investigation. We're also able to mark that as an urgent sample. I had results probably within 2 hours, and the results told me that she had IMHA, but also Evans syndrome as well, which is something you would have totally missed if you'd just done an in-house saline agglutination, for example. So that dog benefited from immediate blood transfusion. So when we knew we had to go for blood transfusion, then we were also able to phone the lab to request blood typing and cross-matching as well. So that was extremely helpful in that case, and that dog did really well. Yeah, we use Pathport here at all 5 of our sites on a daily basis. It's really helpful to be able to browse tests, get the accurate pricing and most up-to-date pricing for tests, and it also creates lovely submission forms for us that we don't have to handwrite that out and all that pre-populated. So it definitely lightens the workload and makes it easier for us to get our submissions ready and packed into the lab. I would say the service that you get from VPG is unmatched. You have clinicians at the end of the phone, you have courier service, you have a lovely online portal to do your submissions, and also returns your results in a PDF format, which is very helpful to, for example, email over to the client or the referring vet, that everything comes back in a lovely, concise format. Yes, I would recommend VPG to any of my veterinary colleagues for ease of submission, speed of reporting, and the fact there's always someone at the end of the phone.